welcome back to Simply Women's Health with CJ. Today we're going to talk about abnormal uterine bleeding, specifically heavy menstrual cycles. This is actually an important topic because approximately 1/3 of women will seek medical attention due to concerns about their heavy bleeding. This is where I'm going to strongly recommend, if you are a menstruating female, for you to download the Flow, F-L-O, app onto your phone and track your menstrual cycles. No, I don't get any money from them, just recommended because I've had a lot of patients who have come in with information that's been very helpful from their Flow app. So how do you define heavy menstrual cycles? If your cycles are lasting greater than 7 days, if you are soaking through a pad or a tampon every hour for several hours in a row, if you are having to double up both pads and tampons in order to avoid soiling your clothing, if you are having to change your pads or tampons at night, if you are passing clots that are bigger than 1/4 in size, these are all things that would indicate that you are experiencing heavy menstrual bleeding. So what causes heavy menstrual cycles? A number of different things can lead to heavy menstrual bleeding. You could have fibroids. You could have polyps. You could have a condition called adenomyosis, where the glands of the inside of the uterus have been shoved into the uterine wall. You could have hormonal changes, especially if your thyroid is getting wonky. It could be nothing at all. This could just be how your cycles are. You could also have what's called endometrial hyperplasia. That is a condition where the inside of the uterus overdevelops, which over time can turn into endometrial cancer. You could be pregnant. Pregnancy can cause you to have heavy bleeding. If you are using a non-hormonal IUD, the copper intrauterine device, that too can cause you to have heavy bleeding. So you've decided that you have heavy bleeding and you've made an appointment to go see your healthcare provider. What can you expect when you go to that visit? First and foremost, they're going to want to get a thorough history. That's where that tracking of your menstrual cycles really comes in handy. They're going to want to know, how often are you menstruating? Do you have bleeding in between your cycles? How long do your cycles last? Do you need to double up pads and tampons? Do you have to miss out on activities because of your bleeding? Are you taking any kind of medication such as blood thinners? Those are all things that they're going to want to know. They're probably going to want to do a little bit of lab work. First and foremost, they want to make sure that you're not pregnant. They're going to typically we do a CBC to make sure that this heavy bleeding hasn't caused you to become anemic. We also usually will check your thyroid, again, just to make sure that that thyroid isn't out of balance. They will, in all likelihood, order an ultrasound. They want to take a look at the inside of your uterus. Again, that's how we see if you have polyps, if you have fibroids. They're going to want to look at your ovaries, because sometimes if you have persistent ovarian cysts, that too can lead to heavy bleeding. If you have concerns for endometrial cancer, you are going long periods of time without bleeding and then bleeding very heavily. If you are obese, they might want to do what's called an endometrial biopsy, where they sample the inside of your uterus to see if you've got precancer cells growing in there. If you're looking for more information regarding the endometrial biopsy, I suggest you check out my video where I talk about endometrial biopsies, ... ouch. Once the provider has all of their diagnostic information together, you can discuss treatment options. Treatment options are going to depend on the severity of your disease or your symptoms. How bad are they? If they're tolerable, you're not anemic, it's just something that's inconvenient, you may opt to just take a wait and see approach and see if your cycles regulate themselves. If you're trying to get pregnant, or if you are considering pregnancy in the near future, they may want to go for medications such as ibuprofen or Motrin, something that can bring the bleeding down a little bit and also can help with any bothersome cramping that you have. If you're not trying to get pregnant, they may want to talk about hormonal birth control, whether it's a birth control pill, a ring, a patch. If you have questions about those things, again, I have video content where I talk about hormonal birth control. They may want to talk about using an intrauterine device that contains hormones, The IUD, either Mirena or Kyleena, can really help bring that bleeding down. 85% of women report shorter, lighter, or even absent menstrual cycles using those products. Again, I have video content where I discuss that in great detail. If you are done having babies and you just want all of this to go away, there are some surgical interventions that your provider can talk to you about. You can discuss the risks, the benefits of all of those things and make the decision that works best for you. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.